Thank you for joining us for today's session regarding adrenal fatigue. My name is Dr. Pam Grover. I practice in Rochester, New York as a functional medicine physician. My background is in family medicine and I am board certified in anti-aging, regenerative, and functional medicine. So our 21st century lifestyle is creating a lot of adrenal fatigue. The things in our lifestyle that create that involve some of our life issues, like financial pressures, job issues, marital issues. We also have lifestyle issues such as smoking, drinking too much coffee, not going to bed soon enough, exercising too much or lack of exercise. We live in a very toxic environment, from our new cars emitting VOCs or our new carpets, also the food preservatives we're exposed to. And then we have body issues such as taking prescription medications, chronic infections, or allergies. So the hormone changes that occur with adrenal fatigue are related to blood levels of cortisol, pregnenolone, and DHEA. So if you look at where cortisol is produced, we have two glands on top of each kidney, which is our adrenal glands, and its main function is to produce cortisol and a few other hormones. That is essential to our life. If we don't have appropriate levels of cortisol, we can't maintain our blood flow because our blood pressure and our heart rate are very reliant on cortisol. But we have backup hormones called pregnenolone and DHEA to help with that cortisol. The way we produce our cortisol first starts with cholesterol. So it's a little bit concerning that the conventional medicine has pushed so strongly that we lower our cortisol to such severely low levels, because that is going to affect the rest of our organs. If you don't have enough testosterone or estrogen or cortisol, then you are going to start to get chronic disease. The next step in the pathway is to make pregnenolone. Pregnenolone is what is known as our memory hormone and our grandmother hormone. Pregnenolone then either goes to helping make progesterone and then cortisol, or it also makes DHEA, which then helps support our testosterone production and our estrogen production. So what happens when we are stressed is that because cortisol is more important or more essential for life than pregnenolone or testosterone or progesterone, is we have a steal syndrome. So the pathway gets shunted to cortisol all the time. So we will lower our pregnenolone to help make cortisol. We will steal our DHEA also to make cortisol. There's a pathway between these two. And that's how a lot of people will get either low testosterone or low estrogen levels, and we're seeing more premature menopause than we ever did before. So there's different ways to test for adrenal fatigue, and that testing can either be done through saliva or through blood. The conventional doctors don't really believe in adrenal fatigue, but they believe in the extreme case of adrenal fatigue, which is called Addison syndrome. When you have Addison syndrome, your body stops producing, your adrenal glands stop producing cortisol and ACTH. So you will be given a prescription called hydrocortisone. I've rarely seen that condition, and those patients usually had type 1 diabetes first. So the gland pancreas that helps make your insulin is like a cousin to your adrenal gland. That seems to go first. We think that there's an immune response, an autoimmune antibody that attacks your pancreas and also your adrenal glands, causing these two conditions. And the trigger likely is some kind of infection. Some people theorize it might be vaccines that could trigger it, and others feel that food intolerances such as gluten intolerance may be another player. In most cases of chronic disease in medicine, it's multifactorial. There were different straws that broke the camel's back that led to that incident. But most of us don't have Addison syndrome. But if we did want to rule out Addison syndrome, which I try to do in every patient, the gold standard is to do a morning fasting blood cortisol level. And that would need to be within 2 hours of getting out of bed. Nothing to eat or drink except you're allowed to drink water. So if that level is normal, we would consider you not having Addison syndrome, but you still could have adrenal fatigue. So then the gold standard in functional medicine for diagnosing adrenal fatigue would be salivary cortisol readings. And you want 4 different readings through the day, because we have a diurnal rhythm of our cortisol, or we're supposed to when we are healthy, which means in the morning our cortisol is the highest and it gradually comes down to almost nothing at night. So when you do salivary cortisol readings, you can do a reading in the morning, one midday, one before dinner, and then one at bedtime. And that way we'll be able to see if you have stage 1 adrenal fatigue, one or more of those readings are high. If you have stage 2 adrenal fatigue, one reading is borderline low or low, and you have another reading that's high. And lastly, you'll have stage 3 adrenal fatigue, which all three are low. But if you can't afford salivary cortisol testing, it's around $120. Then, and your insurance covers blood testing, you can have the morning cortisol test. But I always like to include a DHEA level and a pregnenolone level. So if you go back to this graph, that helps me decipher what stage you're in, because if you're in stage 1, usually the cortisol might be high. The pregnenolone is still okay, but the DHEA may or may not be normal or low. If you get at the really early stage, it doesn't show it here, but sometimes you do see some higher DHEA levels, which could be associated with PCOS, a female hormone imbalance. But that's why you have a practitioner that's knowledgeable about these things so they can help decipher what stage you are in. But as you progress, if I get a pregnenolone level that's starting to be low, and a DHEA level that's low, and a cortisol level that's low, I know you're further in stage 3 of adrenal fatigue, which would change how I treat your condition. One other thing I wanted to show you is what I have learned. It's important to understand when we talk about adrenal fatigue and how to fix it, that adding herbs and vitamins or minerals to help support adrenals is really a temporary fix until you find the underlying cause for adrenals. So I draw this picture for my patients, which is a bathtub filled with the different hormones and nutrients. So we're trying to give you supplements that help you with cortisol production and hormone production and nutrient absorption. But if you haven't filled the holes in your bathtub, the food intolerances, if you haven't fixed that, if you haven't fixed the candida or the heavy metals or the gut bacteria or the nutrient deficiencies that led to the adrenal fatigue to begin with, then you're really just running on a hamster wheel and will never get better. Lyme disease should be on here as well. So I just like to emphasize that point also as we're talking about testing for adrenal fatigue and treatment of adrenal fatigue, that make sure that your provider is looking for the underlying causes, because you can only get temporary relief if you're mainly just focused on adrenal fatigue herbs. Thank you for joining us for today's session on adrenal fatigue.